Psychopathology. By Patience Hill Berardi. Psychopathology is the scientific study of mental disorders, including efforts to understand their genetic, biological, psychological, and social causes. It includes the classification, course, manifestations and treatment options. In this video we are going to look at normality versus psychopathology. We will start by defining normality. Normality is the absence of mental illness, realistic self-perception with contact with reality, a strong sense of identity and positive self-esteem, autonomy and independence, ability to maintain healthy interpersonal relationships. This is the capacity to love, empathy, ability to cope with stressful situations, capacity for personal growth and self-actualization. Before we continue, and before you watch more videos about mental health disorders, you need to know about medical students' disease. This is also called second-year syndrome or intern's syndrome. It is a condition frequently reported in medical students, who perceive themselves to be experiencing the symptoms of a disease that they are studying. With the criteria of mental health disorders, everyone at any given point in their life will appear to meet the criteria for a disorder. An example of this would be social anxiety or generalized anxiety. Someone who is nervous before a presentation may appear to meet the criteria for either of these disorders, but they likely do not have them. Their behavior is probably perfectly normal for the situation. This is why you should never self-diagnose, and you should always seek a professional if you are worried about your mental health. Traditional approaches to mental disorders have emphasized concepts such as symptoms, diagnosis, illness, and treatment, and by doing so they have strongly influenced the way we think about psychopathology and related questions. Mental disorders have most commonly been conceptualized in terms of deviancies involving breakdowns in adaptive functioning, statistical deviation, unexpected distress or disability, and/or biological impairment. The 4 Ds include deviance, distress, dysfunction, and danger. Practitioners are looking for abnormality as statistical deviation such as IQ or height from the norm. Abnormality is deviation from social norms, and deviation from developmental standards such as psychomotor, speech, cognitive. Let's describe of the 4 Ds in relation to abnormality. Deviance. This term describes the idea that specific thoughts, behaviors and emotions are considered deviant when they are unacceptable or not common in society. We define an individual's actions as deviant or abnormal when their behavior is deemed unacceptable by the culture they belong to. Distress. This is negative feelings by the individual with the disorder. They may feel deeply troubled and affected by their illness. Dysfunction is maladaptive behavior that impairs the individual's ability to perform normal daily functions. Danger. This term describes dangerous or violent behavior directed at the individual, or others in the environment. An example of dangerous behavior that may suggest a psychological disorder is engaging in suicidal activity. How do we determine if a behavior is deviant? First, intensity refers to the magnitude of behavior as excessive or deficient. Second, frequency refers to the severity of the problem behavior, or how often it does or does not occur. Third, the duration of behavior must be considered. Some difficulties are transient and spontaneously remit, whereas others persist over time. The final parameter of deviance concerns the number of different symptoms and their configuration. Some specific DSM-5 personality disorders. Classification odd. Eccentric includes schizoid, schizotypal, and paranoid. Classification dramatic, emotional, or erratic includes borderline, narcissistic, antisocial, histrionic. Classification anxious or fearful includes avoidant, obsessive-compulsive, dependent. This last table is a hierarchy of disorders which can be viewed as those which are more safe and have a higher likelihood of remission. Charts like these, for me, are extremely irritating. They continue the cycle of stigma with some, or all, disorders. I've included it for illustrative purposes.